Welcome back, everyone. This is Neeti, founder of Back to Basics Functional Nutrition and the Functional Medicine Nutritionist. As you guys know, this is a MythBuster series. And so every week we pick a topic and bust some myths which are going on mainstream or are less spoken topics existing in our conventional world. So this week, I have the honor of talking all things oral microbiome and the health inside your mouth with founder of Dallas Functional Dentistry and a functional dentist, Dr. Sarah Poteet. Welcome,
Thank
doctor.
you. Thank you, Needy. I'm so excited to be here. This is a fun change from my weekly routine to be able to connect with your audience and share a little insight about a healthy mouth and how do we have a healthy mouth and tips and tricks for families to improve their mouth and oral health at home.
Awesome. Super excited, doctor. Before we begin, why don't you tell our audience you practice dentistry a slightly different way. We call it functional dentistry. So, what is that? Can you explain it briefly and
Sure.
how you went about doing that?
Right. So functional dentistry can mean many things. For me, it's connecting the health of the mouth to the rest of the body and
Mhm.
asking the question, why? What is the
Wow.
root cause to see cavities or gum disease or inflammation in the mouth?
Right.
Growth and development issues, crowding, snoring, breathing issues, they're all so interrelated. And functional dentistry really has more of a holistic approach to the wellness of the mouth, how it's connected to the body. The mouth is such a window or gateway to so many things. When we have inflammation in the mouth, it can affect your heart, your brain, your pregnancy,
Wow.
diabetes,
Yes.
autoimmune issues, gut health. The mouth is part of the digestive system. So my patients that are struggling with gut issues, well, let's look at what's going on with the microbiome of the mouth. Let's test. So functional dentistry does a lot of asking of why, maybe adjunctive testing, like testing the bacteria in your mouth, linking that bacteria to other things going on in your body or your gut,
Mhm.
and really looking at sleep and nutrition, growth and development,
Mhm.
so many things. What is your diet like? Are you deficient in some minerals or vitamins? What products are you using in your mouth that maybe could be wreaking havoc on the balance of your mouth and destroying good
Mhm.
bacteria that we need? So, functional dentistry is a little different than, I guess, just general dentistry, but I love it. It makes it so much more fun and rewarding to impact more than just the mouth or a pretty smile, but somebody's overall health.
Overall health. Wow, that's beautiful and meaningful at the same time. Thank you
Right.
for sharing that.
Sure.
And I remember that was me as well, doctor. Like, if I, in the past 20 years ago, I would just consider myself going to the dentist every 6 months, and that's pretty much it. So my mouth and my dental visit was every 6 months, but I would never connect the dots that is related to my health all year round. It's not those two visits every year, right?
Exactly. It's what are you doing on a daily basis? I mean, we
Daily.
can help you in your at your 6-month visits, or sometimes we see patients over 3 or 4 months. You got to really customize that care plan for the needs of the patient.
Yeah.
So yeah, it's a more meaningful journey when you know the going to the dentist and doing your daily routine is really, I mean, can add years to your life and quality of life.
Right, right, absolutely. And so, talking about oral microbiome, I see the number one myth that most people have, or I see in my practice as well, doctor, is using a mouthwash, antibacterial mouthwash every single day.
Mhm.
In your opinion, is it advisable, not advisable? Can you touch base on that? question.
Sure. So, there's so many different products, mouth rinses, toothpaste. I mean, you go down the dental aisle and it's just so overwhelming. And the average person is like,
What do I
what do all
choose?
these mean? And
Yes.
read ingredients. Don't just take the marketing version of it, but look at the ingredients, because you're going to find on a lot of those mouth rinses, you can't even pronounce what's in them. And there's so many artificial ingredients and over-the-counter alcohol-based mouth rinses, for instance, I discourage on a daily basis, because they're very harsh, and what they do is they strip away our good bacteria and the bad bacteria and just wipe everything out. And alcohol-based mouth rinses can be very drying to the mouth. And when you have a dry mouth, the pH of your mouth drops.
Okay.
So you're going to be more prone to mouth irritations, mouth ulcers, cavities, bleeding gums. So you need the healthy balance of good bacteria to fight off the bad bacteria. So we want to more than just disinfect the mouth. We want to feed or nourish the good bacteria in your mouth and create a healthy environment so you're more resistant to inflammation, cavities, gum disease.
Yes, that makes so much more sense, doctor. That we are stripping off both of them, not just the bad one. Everything exists in synergy in our body, so you cannot just minus the bad ones. You are going to minus the good ones as well.
Right. So I just caution people not to get carried away with mouth rinses. I mean, if we're doing other things to keep the mouth healthy and balanced, you really don't need a daily mouth rinse. There's certain exceptions when we're really struggling with rebalancing or shifting the microbiome. Occasionally we'll do some temporary disinfection of the mouth, if you will, and then follow that up with supplements, vitamins, a healthier diet, more water. You don't want a dry mouth. So adding moisture, and even probiotics. There's some oral probiotics out there that are then putting good bacteria into that environment to keep it more balanced.
Perfect. So first, maybe if need be, doing a mouth rinse to balance out and remove the bad ones, and then balancing it with oral probiotics.
Right.
Wow. Awesome. And so is there any mouth rinse that is like easy, or you can make it at home rather than the conventional ones available in the grocery stores?
Sure. I mean, you could even just do like a warm saltwater rinse. That's just a good basic thing that you could make at home, especially if you're struggling with a sore spot in your mouth. It's very healing. I like products with xylitol. So you can even buy xylitol as a sugar substitute, right? It's a natural antibacterial. It's plant-based. You could put some xylitol in water. If you wanted to also then add a few drops of an essential oil or, a mint flavor to it, you can do that. And there are some that I recommend that are over the counter that are not alcohol based, that are more homeopathic or very natural
garden
that can help. But the ones in the grocery store aisle are not my favorite. So I don't want to get into like naming a bunch of products, but there are options that you can make at home. And I know some people like to do like oil pulling and things like that, because coconut oil or olive oil can be cleansing of the mouth, but I don't want people to rely on that like it's going to miraculously fix their issues. You still need to disrupt the biofilm in your mouth mechanically. So brushing, flossing, tongue scraping, you need to mechanically disrupt that plaque or biofilm that develops, and oil pulling isn't going to do that. But it doesn't hurt. Just don't spit coconut oil down your sink. You will clog the drain.
So save a trip of the plumber by not
right.
Absolutely. Awesome. Awesome tips, doctor. And so, moving on to another thing that I wanted to ask you was, can you talk on cavities and bleeding gums, and just elaborate on how that is not normal, because
No.
at times it's accepted. Okay, once in a while I get cavities, and that's normal. So,
Oh, right. You're so right. It's so frustrating when people just assume it's a normal thing for your gums to bleed or a cavity once a year kind of situation. It's not normal. If you have a healthy mouth, you should be cavity free and your gums shouldn't bleed. So it's a sign of inflammation, right? And then it's like, why is this inflammation happening? It's not always my gums are bleeding, so I need to brush and floss more, or I need to use a mouth rinse. No, it's okay, what is your diet like? Are you eating a high carbohydrate, high sugar type of diet? Are you drinking enough water? Yes, what is your brushing and flossing routine? We need to bump that up sometimes. But cavities are not normal, and it's often a sign that your mouth is dry, your pH is too low. Gosh, you could be mouth breathing and snoring in your sleep, and then that's causing a dysbiosis in your mouth. It's not just sugar that's our culprit. Now, I don't like sugar, so sugar feeds the bacteria in your mouth, and that's what is a cause of cavities. Cavities can often be passed from family member to family member or person to person. So if you have a high strep mutans bacteria level in your mouth, sometimes that's from a parent passed on to a child by sharing spoons or pacifiers or in close contact with somebody. So, and that really sets you up for a higher risk of cavities. So the balance of the bacteria, your nutrition, your home care, how are you breathing? If you're breathing with your mouth open in your sleep, that's a main cause of cavities and bleeding gums that we see. So there's so many things we think about, but no, it's not normal to see cavities and gingivitis or gum disease on a regular basis. And I don't know where we got to thinking that that was okay or normal or expected, because there's so many things now we can do to prevent that cycle from reoccurring.
Yes, absolutely. Love that, doctor. And so, like you emphasize, that there are so many lifestyle factors that goes into effect. So, getting to the root of the problem and preventing it from happening, making sure you are not mouth breathing, you are not snoring. So, all of those are just as important as your mouth rinses, or thinking of other things that you would be considering for all things oral microbiome.
Right. And in the nutrition world that you live in, when I see somebody's gums bleeding, the first thing I ask is, what is your vitamin D level? Because studies show if you are low or even in that normal low, you know, there's such a wide range of what's acceptable in vitamin D.
Right.
Normal versus optimal. If somebody is low in vitamin D, their gums are going to bleed more. Their bone and their jaw is not going to be as healthy. So get your vitamin D checked, supplement accordingly, work with a nutritionist. You know, what is your D3, K2, magnesium, vitamin C? Just these micronutrients are so important to keeping your mouth healthy. So bleeding gums, I think of diet, nutrition, vitamin deficiencies. You know, that's an easy thing to improve pretty quickly.
Pretty quickly. Yes, absolutely. Wow. Sure. Yeah. And so that was a wonderful conversation, doctor. And I know I can talk all day with you on this
Yes,
topic.
I know. I can nerd out with you as well. So I know we're trying to be short and sweet with our audience. But
with our audience, so they can
learn more, contact us. My website, DallasFunctionalDentistry.com. So I'm in Dallas, Texas. And we're happy to answer more questions or visit with anybody if they want to do a deeper dive.
Beautiful. Yes. And in the comment section, I'll be putting the link to your website as well, so they can find you and connect with you. But it was so wonderful chatting the non-conventional way of thinking with you, Dr. Poteet.
Yeah, we'll do it again. We can touch on some other things.
Other topics.
Yeah,
Yes,
yeah.
exactly. Thank you,
Okay.
doctor.